powered by Riverside FM.
Welcome to The Pursuit of Health, the podcast of Americans for Free Choice in Medicine. I'm your host, Rainier Schur. Joining me back on the show is Jared Rhodes to continue our discussion of rethinking American healthcare from a philosophically informed and pro-freedom perspective. Welcome back to the show.
Thanks, Ray. It's good to be back.
So the biggest story in healthcare today is, of course, the debate about whether or not to extend the ACA enhanced subsidies. But a big feature of that whole debate aren't merely the enhanced subsidies themselves, but the Affordable Care Act itself, otherwise known as Obamacare. There's a lot of pushback against these subsidies because they are part of Obamacare. How should we think about that, Jared? Like, where is that all coming from?
Yes, I'll explain briefly what this enhanced subsidy thing is, and then we can talk about how it relates and so on. The enhanced subsidy is a special boosted subsidy that is given to people who are purchasing health insurance through the Affordable Care Act marketplace, and the enhanced subsidy was put into place during the COVID era. And the idea was that it was extra difficult during that time for people to purchase healthcare, especially or purchase health insurance, especially with like disruptions to their working situation and so forth. And so those were put in place, but now they are set to expire. And this whole question of, well, should they be allowed to expire or should they be renewed, has sort of is sort of shining a light back onto the ACA more broadly. When you say if you take the position, hey, they should be renewed, you're sort of accepting like a continuation of the kind of system that we've had for a number of years now. If you're looking to push back on that and you're saying no, they should not be renewed, then it opens up the question, should anything be done for those particular people instead, right? And so that is part of why we're talking about this again.
And it definitely strikes me that one of the motivations for not extending it, um, other than immediate relief for the people that would be affected, is a lot of Republicans, especially, have this long history of being against the Affordable Care Act, right? So, like, even though they might want to extend the subsidies to avoid hikes in premiums, what they don't want to communicate is any kind of support for a program that they've long been against. But what I do find interesting about that dynamic is that even though there are a lot of Republicans who say that Obamacare is a failure, there's still this kind of struggle to come up with any real alternatives. I mean, there's a whole bunch of plans being discussed right now, but there's trouble coalescing around them. And as will become clear in this episode, you and I, Jared, we definitely think that Obamacare is a failure, but we also think that a lot of people don't really appreciate why it is a failure. And I definitely think that if you don't have a proper view of why Obamacare is a failure, well, then you're probably not going to have a lot of success coming up with a real alternative. I think that the lack of real alternatives, or even um, coming around like as a political party to like a real alternative, is a feature of not really grasping the failures of Obamacare. And that's what we would like to get into today. And rather than starting off why Obamacare is a failure, let's just first get into what was Obamacare trying to achieve when it was first being legislated, and how was Obamacare different from other healthcare reforms that came before it, Jared?
Yeah, I mean, Obamacare, it was a big and major change to American healthcare. It was the biggest change to American healthcare up until that time. Going back to, let's say, Medicare and Medicaid in the 1960s. Um, nothing in the 70s or 80s or 90s or aughts were had as big an effect on healthcare as did the Affordable Care Act. Um, there and to like list through all of the provisions would take a long time, but some of the highlights and impulses behind it were basically to use subsidies to address this idea of affordability. How do we help people buy coverage? That was like a real kind of key part of this. What do we do with people with pre-existing conditions? Um, how do we make sure that health plans meet defined benefits and standards, right? I don't know if you remember all the discussion about like quote junk insurance. That's a whole other interesting topic to talk about, but very kind of pejorative view of certain types of insurance plans. Um, and and so of course the a big part of it was reducing the number of uninsured. In fact, if you stop most of the major advocates and said, okay, what's the one reason that you want to do this, back in turning the clock back to 2009, 2010, it's, oh, we've got to reduce the number of uninsured, the people that don't have health insurance, whether they are choosing not to buy it or they can't afford it. It is expensive, and so that was like really kind of the sort of the main reasons for them to be that they passed this.
And
Um,
how did this kind of approach to reforming healthcare differ or overlap with other approaches in the past?
yeah, I mean, so if you compare it to some of the other ideas that were floating around at the time, it's a bit different. Um, for instance, like if you're comparing it to like straight up single payer, a system in which the government actually pays the healthcare bills of everybody directly, which that would do away with all health insurance companies, basically overnight. That would put them out of business and basically replace that function with the government doing that. That was an alternative plan that was on the table. There was also previously there was a discussion about like, well, what about like a public option that's sort of like a light thing that you could buy into if you wanted to. It was like available to everybody, and it would be designed in a certain way that would have meet the certain quote standards. Um, Actually, versions of that still exist. People will once in a while talk about like, well, what if we open up the federal employee health benefit plan to just like everybody in the country, that way they have like a bare bones option, if they need to. So those are some of the other sort of approaches that were discussed at the time. I think one thing that I think is interesting about the Affordable Care Act is that some of it was actually couched in terms of markets, even though when you look at how it actually is designed, there's not much real like actual genuine free market things happening there. The whole idea of having an ACA marketplace. I always laugh when I hear that word. I mean, it's designed and in some cases implemented by various governments at different levels, state or federal. But very highly regulated, and how it has to work is all spelled out by the Affordable Care Act. Yet it's interesting, isn't it, that they sort of felt the need to call it a marketplace, almost like they know that at some level, Americans like the idea of like, like shopping for something on a marketplace. Like there's somewhere in the American psyche, people want markets, but the designers of the Affordable Care Act weren't willing to go there. They just wanted to sort of borrow a little bit of the terminology. Um, Same thing with so like the individual mandate. I mean, that was part of it. Insurer risk sharing. Um, there were subsidies in various ways to sort of approximate affordability. there's talk about private choice. You can keep your doctor if you like your doctor. You can keep your doctor, right? That's an appeal to a private choice kind of thing. I think they know at some level, the people who were advocating for the Affordable Care Act, that saying saying to the American public, we're going to pick your doctor for you. They know that that's a political loser. But again, they're not really willing to go so far as to letting it be a totally free market. It's like they want a kind of contradiction. They want some sort of securities and guardrails on something, but not recognizing that what brings you the benefits of the market is people's ability to create and produce innovatively, and come up with new things that you can't even think about and design as a central planner.
Right, and I think that that's also what's interesting about Obamacare is that when they were trying to pass it, people were sensitive to the accusation that, oh, this is socialized medicine. If you like your doctor, you can't keep them, right? It's like a very common criticism. And so I think it was very important to sell Obamacare as, on the one hand, we're going to be able to extend coverage. Of course, there's the individual mandate, which is not voluntary. But then in all other respects, oh, you can keep your doctor. It's compatible with patient choice, with the ability of doctors and even insurers on this marketplace to try out different things and whatnot. And what I think is interesting about that is that that's also how other forms of government involvement in healthcare were sold to the American people throughout history. Um, for example, the AMA, and this we covered this in a previous episode. They touted this whole idea of expanding insurance, private insurance, which they called the voluntary program, um, in a way that made it sound like it was a free market. Now, obviously, um, it wasn't, because they had already gone after group practices and all these other things that were coming up in what would have been a free market. They just wanted healthcare to be paid in this one way. But the way that they convinced the American people to go for that rather than a national health insurance program was to convince them that this is the free market, right? Like this is pro freedom, even though it came with all these forced ways of interacting with doctors that was not actually up to free individuals. It was either the federal government pushing it one way or the AMA with its own clout through lobbying and the state medical boards pushing it another way. And we'll come back to the theme of whether or not it's those two things are actually compatible, whether you can have like this model where health insurance pays for as much of healthcare as possible, and the freedom of both doctors and patients to make their own decisions. We'll definitely get back to that question. Um, for now, let's just get into, okay, so now we know what Obamacare was trying to do. Um, how exactly did it fare? Now, that's obviously a question that the answer will differ depending on who answers it. But I think that's worth going through it because I think it's important to get a sense of why, for example, Democrats thought it succeeded or failed, and Republicans, because then we can see like what the landscape is and yeah, where our own views could fit into that.
Yeah, there's and it depends on what you choose to look at as evaluation metrics here and everything. But I mean, certainly, if you press me to say, what did it accomplish in the good sense? I mean, in a sort of mandated kind of way, it covered people who didn't previously have coverage. I mean, you can grant that. Now, there's all sorts of caveats to that, like, well, does getting a card in your pocket that you carry around in your wallet, that says that you have coverage, does that actually amount to coverage if you can't find a primary care person to take you on? Did it change the system in a way that actually made it affordable? I mean, let's talk about for a second, like the name of the thing, right? It's called the Affordable Care Act. I actually will hear academics who support this even concede that it did nothing to really make care affordable. It's actually interesting that's something that there a lot of folks who would say that they're even supportive of of the policy for other reasons would say, well, no, I admit it didn't do anything for affordability, which is interesting, because again, bills are named are given names in order to sell them, right? Bills are not necessarily named be for what is actually contained in them or for accurately predicting what's going to happen when they get implemented, but they're named as it's like a sales tool, how you name your bill. Um, so anyway, it does reduce the number of people uninsured. Um, and there's some other like popular things. Again, we can dissect these, but at least on the surface level, you can say, well, something that's really popular is the protection for pre-existing conditions, right? Again, like there's more to say to say about that, but that's something that many people would claim is something that it did positively. Um, and I mean, I guess you could say it, standardized benefits or something like that too. Um, but I think more importantly is like where it failed. I mean, it certainly failed in cost control. Premiums on the ACA exchanges, that marketplace that I talked about earlier, those have risen. It hasn't done anything to um, stem the rise in healthcare expenditures generally. I don't think it is the the amazing reform, now that we're what 15, 16 years out from its inception. I don't think it's been the transformational reform that people were hoping it would be.
And so, Jared, how would you say Democrats and Republicans, each respectively, would evaluate Obamacare now? And yeah, basically, how do the different political parties think about it? What's their general evaluation of it, of the program?
Yeah, I mean, I think Democrats, this is broad strokes, but I think they're still tend to be proud of it. Like I said, though, they've conceded that it didn't do very much for affordability generally. I think they still see it as something that they support. Um, and I mean, on the Republican side, the Republicans they've had opportunities to change it over the years, and they haven't really done much. It's actually it might be harder to say what does the average Republican. Maybe there is no average Republican opinion on this. Um, they reject it for various reasons. Typically, they know that they should be against it, but I don't think they have a clear alternative or a clear, even really maybe a clear reason why they're against it. There are so many kind of concessions. If you take what could have passed, which would have been something like the single payer, and then you look at what actually did pass, it's almost like there were some concessions in there. Um, for instance, like the Affordable Care Act does not replace all private insurance, and it doesn't even institute too many price controls. There could have been much more, is what I'm saying. If the Democrats had really been able to put absolutely everything they wanted in there, there was enough pushback. This did pass on a completely partisan vote, if you remember. Not a single, every Democrat voting for it, and not a single Republican voting for it. Um, I think the Republicans they push back against it, but fairly weakly, I would say.
And what do you think is missing from these explanations and evaluations of Obamacare, right? So, I mean, really the kind of strongest criticisms that I've heard about Obamacare from Republicans is something about how the program is managed, and really very often it seems like they were against Obamacare because Obama was its author, who knows, maybe it would be different if a Republican was for it. What do you think is missing from these? I mean, to the extent that we agree with Republicans that it is a failure, what's missing from explaining why it's a failure?
I mean, I think there isn't a view of what a real alternative would be. That's part of it. What's the pro freedom kind of alternative that this can be put in contrast to, right? And so you get certain, I think you get certain assumptions that uh, get absorbed. And so like even Republicans, I mean, that's again kind of difficult because there's a bit of variety on that side. But generally speaking, maybe your garden average Republican is still sort of okay with insurance being used so broadly and to pay for so much of healthcare. That's sort of like a premise that hasn't been challenged too much.
What strikes me about the failure to grasp the failure of Obamacare is how what we alluded to earlier, in many ways, wasn't radically different from what came before it, right? So, what came before it is that, sure, you had these specific programs for particular groups like the elderly and the poor, but all of that was based on this notion that the way that we're going to pay for most of healthcare is through insurance, right? And again, this kind of promise that we can have the kind of uh, goal of socialized healthcare where everyone is covered without any of the losses in either patient or doctor freedom, right? Like we can have it both ways. And I think that you can have it both ways. That necessarily in that kind of a system, uh, you would have to impose more controls. And so, if anything, Obamacare didn't go f nearly far enough in controlling the cost of healthcare, for example. Like if they really wanted to do what we do in Europe, right? Like I'm from the Netherlands. We have a uh, not dissimilar system of an exchange where nonprofit insurers sell you health insurance, and that pays for your healthcare, but they're all not nonprofit. So like we've outlawed the for profits, and that controls how you interact with your doctor. And let me tell you, it doesn't feel very free. It's very hard for me to see my doctor, and I know that for certain things, it's not worth me trying to see him because I know he's not going to get reimbursed through it. So it's just not true that you can have this vague, elusive ideal of being covered and then still having the freedom as a patient or as a doctor to make your own decisions. And that's just not only a failure of Obamacare. That's a failure of the kind of basic template that we've had for healthcare reform in America since, well, at least since the 50s when the American Medical Association tried to expand what it called voluntary health insurance as an alternative to like a national health insurance program. And after that, when they failed to stop that and Medicare and Medicaid was passed, uh, this insurance model led to an explosion of the cost of healthcare because basically what that model disincentivizes is any kind of consideration for doctors or patients to consider costs. And so it wasn't simply doctors being greedy or bill padding or overutilization. Even if they did nothing of that, there was no reward for a doctor under that kind of model coming up with a more affordable way of achieving someone's health. And um, what therefore happened as a consequence was that these insurance companies both private and government, had to start imposing cost controls, which then eventually led to the management of care by the insurance companies, which then you really see all the sorts of ways in which this idea of complete coverage that just leads to controls and a loss of freedom for patients and doctors.
So there's this idea too that is really influential here, which is that patients shouldn't have to pay anything at the point of care. And that also feeds in and sort of plays into this overinsurance in some sense system that we've evolved into. The idea is that patients should be able to not have any kind of cost consciousness that it would be a bad thing for somebody to go to the doctor's office and have to make a choice about what course of treatment to get or how to how to navigate that financially. And even the doctors have gotten in on this as well by reinforcing that by saying, well, yeah, we don't want to be involved in that either. They think that they should just be able to quote, practice practice medicine without any almost context free. One I think premise to challenge in all of this is this idea that care should be costless at the point of care. It does, like I said, it does lead to um, an over reliance on insurance and the this impulse which different parties are sort of more or less willing to engage in, but um, certainly that more and more should be covered, and which of course is only going to increase the price of health insurance, and so that's why, in part, why premiums are so high. And then because nobody else is willing to exercise any kind of cost conscious, neither the patient under this view nor the physicians and the associated providers, that's when you get health insurance companies saying, well, I guess we're the ones who have to exercise some kind of cost consciousness. And then that leads to things like them getting involved with, requiring prior authorizations and all these things that we love to hate on. But you kind of have to understand where it's all coming from in order to have I think, a more thoughtful critique of the whole thing.
And one thing that I think is worth pointing out is that there are some people on, for lack of a better term, the political right that um, accept this over-insurance argument, right? And so they do advocate for uh, catastrophic health insurance plans and the ability for patients to shop around for things that aren't suitable for insurance, right? Because it's not the thing that insurance is this terrible thing. It's that insurance is the idea of insurance is a great thing for things that it makes sense for, right? For things that are catastrophic, unexpected, high cost. But to use it for all these other things is not good for those other things. And then like you're kind of like even ruining the value of insurance for the kinds of conditions it was meant for. So there is a recognition of that, I find, somewhere on the political spectrum. But what's still lacking there is what takes its place, right? And what you really the only thing that I see there is somehow the consumer will shop around and get a better deal. But what are they shopping around for, right? And what's really needed there is um, not just another model, right? I think that's another kind of problem with the whole history of American healthcare reform is that we just need some better model for doctors and patients and insurers to interact. But I think what the history of American healthcare shows is that what you need is the freedom to experiment and innovate in different ways of financing and delivering healthcare, right? We need the freedom to engage in different models, not just have a slightly better version imposed on us by Republicans or Democrats. And when you allow for that kind of freedom, people come up with new ways of paying for healthcare, and you see that in the little pockets of healthcare that aren't as regulated, right? So you get something like direct primary care, right? Which is not a model that any politician came up with. It's just that in some states, if a doctor doesn't accept insurance, they can set their own prices and they can come up with their own way of profiting from delivering affordable care to patients. And so it's not simply enough to move away from this insurance-based model for providing most of healthcare. It's recognizing that you need freedom to come up with new ways of paying for healthcare. And that's really what's missing from this whole debate.
I agree. We would have such variety of different ways of addressing your needs, tailored to as many different categories of people as we might have, and people could even move freely in between. You might be a primarily a DPC patient. You've got you've subscribed, you have your membership with one primary care, and your general approach is to pair that with a high deductible health plan and everything. But then in certain circumstances, maybe when you're on vacation or something, you do something differently. There you do out-of-pocket telehealth to connect with some need that you have on the spot, right? These things would arise, and to your point, it's not a single model that this ends up formulating, and no politician is going to formulate it in by some grand design. Um, the the other thing too is that um, we we like it's hard to advocate for certain particular changes because oftentimes that's not enough to get the whole sort of ecosystem going. You could take on the issue of like HSAs, and you could do something good in that regard. Maybe with like the limit contributions, or how they interact with other types of coverage and satisfy different kind of needs there. But if you just change that, but don't change anything about the sort of the culture that, for instance, physicians have about whether they should be selling you their services in a particular way with like a stated price and in a customer friendly way that you would expect in any other industry, well then the sort of added ability of a person now with an HSA that has some quote money to spend, they're going to be baffled, like, well, where am I supposed to spend this? And then if you just send them back into the regular kind of system, it's not really going to give you the benefit that you were hoping for. And then you might be disillusioned with that. You might call that a failure or something, but it really isn't. It needed the next thing downstream in order to really get the success and benefit from. And so that's always been one of my fears, that we sort of make and the small changes are needed, right? Because that's a lot of times that's what's politically possible, and you can make that next incremental step. But you also have to communicate and kind of manage the expectations of, well, we need this. This is part A, and then the next part that this connects with in the sort of system. I would even call it maybe like an ecosystem, not a model like we were talking about. But you need those other things in place to really get the full benefit from. And so it sometimes feels like the pro freedom approach is like at a disadvantage because we need multiple things to happen in order to really demonstrate how powerful this idea could be.
And just to touch on what you were pointing out, it's not simply that we need multiple policy steps to get to a better place. We also need a certain change in culture and certain kinds of expectations and different ideal of what our relationship with doctors is, right? Like in the same way that the healthcare system we have right now is based on this ideal that when I walk into my doctor's office, I don't have to think about costs and he doesn't have to think about costs. And that somehow makes the interaction better. But really, we need to move away from that and recognize that if my doctor isn't thinking about cost, not only could that come at my disadvantage later if like I can't afford it? But I want him to think about what things are worth because I want him to think innovatively about, well, what if this particular treatment is low value, for example, and what about this other kind of treatment which is high value but costs a lot? And I'm going to think about a way to make it more affordable so I can make more money and help more of my patients. Like that's the kind of relationship that I want to have with my doctor, right? Where like we can sit down and frankly talk about what things cost because that helps me think about my own health. And so it's not simply policy changes. We need a change in culture. So just to wrap things up a bit, um, our perspective is that the that Obamacare is a failure, but that its failure is not unique. It's based on other assumptions in the American healthcare system in the way of reforming it that have also failed, right? This ideal that we're going to have insurance cover as much as possible, and this promise, which I think is a false promise, that you can have all that and it's not going to reduce either patient choice or the freedom of your physician to come up with new ways of taking care of you. That's the real lesson to take away from Obamacare is that that's a lie, and that if you take that seriously, it should not just change the way you think about Obamacare, but all of American healthcare. And the solution to that is that, okay, well, we just need another model. That's also wrong. I think that that's really missing the deeper point. The deeper point is that there's many potential ways for us to finance and deliver healthcare. And we need the freedom in order to experiment with that. And no particular model is going to uh, save us, right? And to the extent that models are proposed, I think that they should be seen as a way to get to a place like that, rather than this particular model, even if it claims to be free market, is the alternative to Obamacare. And so, on my final question, Jared, how do you think this lesson should inform how we think about the current debate about extending the ACA subsidies?
Yeah, so to bring this back to the thing where we started from, the very specific question about the enhanced ACA subsidies, um, you know, taking all of what we've just discussed and then returning to that kind of question, it almost makes you realize how kind of, I don't want to say inconsequential, but I mean it's a small kind of issue right now. Whether we let those expire, it's not going to save healthcare, and if we continue to if we renew them, that's not going to save healthcare either. The current today's debate over the enhanced subsidies isn't really the big question. The big question is what we've been talking about in this episode, where where the idea is like, how are you going to really execute on a more fundamental reform? And that's what I think, in some way, the narrowness of today's particular debate over the enhanced subsidies starts to show that's not the big important thing to be discussing.
That's the perfect way to end, and I want to thank our audience, and till next time.
Thanks again for having me, Ray.
To stay up to date on our newest episodes, subscribe to our show from whatever podcast platform you are listening from. To support our show and Americans for Free Choice in Medicine, you can make a financial contribution at www.afcm.org/donate. Thank you for listening.